Our health system is supported by a diverse array of public, private, and non-governmental entities. Through the strategic partnerships with these sectors, including faith-based organizations, the government has expanded healthcare access nationwide and enhanced capacity to tackle health challenges and emergencies efficiently. It is important to state simply, directly, and clearly that the U.S. government has been our greatest ally in this sector. Here is the headquarters of an iconic U.S. organization, preeminent global authority on public health, and a symbol of science working for the people everywhere in the world. When I saw the center up on second floor, I was amazed at what is happening here and the response you have from actors in different parts of the globe. The CDC's ability to partner effectively with diverse agencies, coupled with Kenya's commitment to strategic collaborations, have enabled us to develop a high capacity to effectively respond to public health challenges and public health emergencies. Mindful of this capacity, Kenya is pursuing a bold bottom-up transformation agenda to drive inclusive growth, create jobs, create wealth across many sectors. Central to this is the implementation of our universal health coverage plan. Partnerships, especially with the U.S., are crucial for our success. To underscore this, I have made it abundantly clear that every cent of technical, financial, or other support from our partners must be managed, utilized, and accounted for efficiently. This requires a shared understanding and collaborative approach, including joint activities, unified planning, and budgeting towards agreed upon health outcomes. I therefore encourage you to enhance support for better coordination, aligning efforts to improve our health systems. This includes prioritizing and investing in the implementation of the Kenya Health Sector Partnership and Coordination Framework. Somebody has discussed that particular aspect here. Our visionaries in the Silicon Savannah are driving the digitization of health services, improving service delivery, promoting preventive health, and enhancing access to medical expertise through telemedicine. This digitization optimizes health resources, including human capital, and enables remote medical reviews, enhancing accessibility regardless of location. During the 28th Conference of Parties to the UN Framework Convention on Climate Change, I launched the Africa Green Industrialization Initiative to boost green industries across Africa, promoting climate action and economic growth. My vision integrates climate change with healthcare digitization, aiming to fully digitize public hospitals and transition them to renewable energy in the very near future. I am very happy that we have $31 million to further this course. I also appreciate Power Africa, USAID Global Health Bureau, and partners for their initiative to connect 10,000 health facilities in sub-Saharan Africa by 2027, a truly inspiring endeavor. We also welcome the Health, Electrification and Telecommunication Alliance to collaborate with the Ministry of Health and the county governments to enhance these vital linkages for the benefit of millions. Ladies and gentlemen, our transformative partnership with CDC is a powerful example of the positive impact of shared values, commitment, and innovation on people's lives, present and future. In reinforcing the broader Kenya-US Partnership for Democracy, Security, and Prosperity, success is not magic, but the results of consistent application of our values in pursuit of collective goals. Through partnership, we are not just changing the landscape of public health, we are touching lives and changing the world. I am encouraged by the robust spirit of collaboration, and we are grateful for the support of CDC in establishing the Kenya National Public Health Institute. We are looking forward to working together to develop policies and legal frameworks based on evidence for the Institute's success. Our collaboration with CDC extends beyond defending our own borders, significantly enhancing regional and global health security through strengthened research, laboratories, surveillance systems, and emergency operation centers. Programs like field epidemiology and laboratory training and public health emergency managers have already trained 800 professionals, and we aim to expand them to include more county and national health workers. I am reminded by the statement that was made that working with the county governments, we now have close to 100,000 community health promoters in Kenya to support this endeavor. To do this, we invite America's leading health training institutions, such as Pelham Center of Advanced Medicine, Johns Hopkins, Harvard, Columbia, Duke, and Emory University in Atlanta to create exchange programs with Kenyan universities. Through such collaboration, we aim to expand learning horizons and deepen insights into emerging threats, including zoonotic diseases. The impact, innovation, and focus of the collaboration between Kenya and CDC has set a standard that transcends our boundaries. Another organization which highlights the positive impact of effective partnership between Kenya and United States organizations is the Kenya Medical Research Institute. The partnership between CDC, the National Institute of Health, and KEMRI, spanning 7 research programs, has led to significant scientific discoveries, notably the malaria vaccine, enhancing healthcare outcomes. Increasing grants to KEMRI will help establish strong intellectual property and scientific entrepreneurship frameworks. This will support Kenya's focus on product development, a key component of our pharmaceutical and biomedical manufacturing sector, aligned with our priorities. When I paid a visit to Revital in Kilifi, I was persuaded beyond any reasonable doubt that we have the requisite ability and capability to manufacture international products from Kenya. And I made a commitment to local manufacturers that the first off-taker of their products will be the Kenya government. I think local manufacturers, including Revital, today can confirm that we have changed course and they are our first port of call when we are looking for medical products. I have also made a policy decision that we are going to support local manufacturers, and specifically Revital. We have already offered them extra land for them to expand their operation and meet the targets they have told us here that they want to meet next year. And it is not just for them, it is for all the other manufacturing facilities that we have in the country. In fact, we have designated one special economic zone in Thika to be the manufacturing hub for pharmaceutical products, and we will be offering incentives for manufacture of pharmaceutical products for Kenya, for our region, and for the globe. And looking at what Revital is doing, we are very confident that we can export to anywhere in the world. Regarding manufacturing, Kenya actively seeks due recognition as a stable, well-functioning and integrated regulatory system in the form of the World Health Organization's Maturity Level 3. Amendments to the Pharmaceutical and Poisons Board Act are in progress to support this goal, enhancing local pharmaceutical growth in both public and private sectors. I did come with the leadership of Parliament so that they understand the importance of us changing the law, and they are here. And they have promised me that how many weeks after we go back, how many weeks will the law be ready? In less than 2 weeks. In less than 2 weeks, I will have signed the law so that we can provide the legal framework for us to move our manufacturing to the next level. Amid growing interest from Asian and Middle East companies to invest in Africa, I warmly invite U.S. investors and manufacturers to explore opportunities in Kenya. With access to markets, including the East African community, a market of 300 million people, the common markets for Eastern and Central Africa, a market of another 400 million people, and the Africa Continental Free Trade Area, a market that will expand to 1.4 billion people, manufacturing and medical consumables, vaccines, is a strategic investment. I commend USAID for supporting local manufacturing investments like Revital and Dawa Limited through capacity building and matching funding. The President's Emergency Plan for AIDS Relief, PEPFAR, stands as a remarkable example of our fruitful partnership in combating HIV/AIDS for over 20 years, transforming despair into hope and prosperity. Together, we've turned a once fatal disease into a manageable condition, achieving significant success in global health. Through collaboration with the US, Kenya is transitioning HIV, malaria, and tuberculosis programs into primary healthcare initiatives, aligning with Sustainable Goal number 3. This shift enhances program sustainability and meets the healthcare needs of vulnerable Kenyans across the country. The year 2020 marked the beginning of a dark era in health as the COVID-19 pandemic disrupted every aspect of our lives. Poor coordination, limited information sharing, and inadequate supply of commodities exposed glaring gaps in healthcare systems globally. Suddenly, readily available resources like oxygen became scarce and unaffordable for those in dire need. Recognizing then, as we do now, the imperative to strive for better, we aim to deliver sustainable health security for all our populations. Kenya is rapidly advancing towards health security. In 2022, we launched the National Public Health Institute to enhance coordination and strengthen our public health systems in response to COVID-19 pandemic. This milestone signifies our commitment to improving capacity for early detection, rapid response, accurate testing, and effective recovery management. The Institute marks a substantial step towards self-reliance, positioning Kenya as a vital contributor to global health security.